Wellness Wednesday. Many Maryland kids are halfway through their first week of school and they're focusing on their mental health.
So with that in mind, Dr. Kurt Ela, a licensed clinical psychologist with MedStar Health, joins us this morning to talk about how they're kind of managing this and how to get through it. Doctor, thank you so much for joining us. So talk to us about how and why students focus so much on perfectionism, just being perfect.
Absolutely. Thanks for having me, especially around this important time of the year for kids. It's a big week. It's an exciting week, but it comes with a lot of pressure as well. And both parents and kids put a lot of pressure on themselves to really get back to school in the best possible way, which is a nice sentiment, but it'll never go perfectly. We'll never feel 100% ready to get back to school.
Yeah, so I know this is on a lot of people's minds right now, but how does perfectionism cause stress?
Well, it sets a bar that you're unable to achieve. And so kids and parents, they see things, whether it's on social media or their friends or just their own perceptions of how a perfect first day back to school is supposed to go. And of course, it never goes that way. We'll be running late or things will be forgot to be packed, things like that. And that's real life. So we want to remember that real life can be messy, but it can still be very rewarding as well.
And you talk about it coming in kind of two phases, one socially, and then the other is more just kind of academically. So how do maybe those two things kind of combine for the perfect storm?
Right, exactly. It's sort of pressure from one end and pressure from the other end. So you want to fit in and be a part of your peer group, which is super important, but you also have to pay attention and get the grades. And there's a lot of pressure around, even at a very young age. If you don't do well, you won't have a good future. And the pressure is overwhelming. So I just say take it a day at a time. Try to make friends, try to find your group. Really don't put too much pressure on yourself, certainly in the first few weeks and months of school.
Yeah, I know a lot of parents are also worried about bullying. You know, they're wondering how to have conversations, how to tell their child that it's a reality unfortunately, for some people.
It is a reality, and it's what parents fear the most, and of course, it's terrible for the children. And so, what I always say is that you want to build 1,000 little connections with your child so that when something big happens, they're going to be ready to share it with you. So every day you check in, you build rapport, you build trust, and if something like bullying happens, they'll be the first ones to come to you and say something's not right at school. And of course, always speak up with the teachers as well. Schools are doing a lot better these days around bullying, but it still happens quite a bit, unfortunately.
Yeah.
And Doctor, are there some cues that you look for if you think your child might be might be stressed out a little too much? What are you looking for here?
Well, that's a great question because sometimes there aren't really cues and sometimes there are a lot. And so what we would look for would be sometimes there's physical symptoms, like if a child who's normally pretty healthy has stomach aches or headaches or they're not sleeping well, that's usually a sign that there's some anxiety around that. And with regard to emotions, people might be afraid to get out of the car or get on the bus and really have some separation anxiety. And so that's a hint that maybe the child's struggling a little bit as well. And so I encourage parents just to speak to it directly and ask them how they're doing.
All right, we only probably have about 10 seconds left here. Let's end on a positive note. Can we spread some positivity, anything parents can take with them before we say goodbye?
Yeah, just that they're very likely doing a great job. The fact that they're worrying about it is a sign that they care, and they're doing better than they think, and the kids are too. So take heart, you're doing just fine.
All right. Well, great way to end.
Yes.
Great note to end on. Dr. Kurt Ela, thank you so much. MedstarHealth.org is the place to go for more information.
Thanks for having me. Appreciate it.
Thank you for joining us.